Welcome to our health promotion video. Today we are focusing on WASH, which stands for Water, Sanitation, and Hygiene. We will take a closer look at the island of Papua New Guinea, a country home to 800 languages and cultures that celebrate traditions. We see how their lives are affected by water, the access, safety, and education surrounding it. Using the social determinants of health model, we can see how the government's actions affects the people. With a better context of the situation, we look at the relationships between the islanders' behavior and the effects on their health.
On the island of Papua New Guinea, located off the north coast of Australia, water access, sanitation, and hygiene are health promotion issues that greatly affect the health of the population. Statistics indicate that 60% of Papua New Guinea's citizens don't have access to safe water, and 55% don't have access to improved sanitation. This is due to government policies being introduced but not being carried out. WASH planning is still under development and is anticipating formal approval. Furthermore, 10% of the total population death rate is WASH-related. This is especially prominent among young children under 5 years old, as younger immune systems tend not to be able to overcome diarrhea, acute respiratory infections, and other waterborne diseases.
The Papua New Guinea government prioritizes the development of sanitation facilities in urban communities over rural communities. This is a major concern as approximately 87.5% of the population exists in the rural communities. Among the rural population, only 16% of households receive clean piped water compared to the 74% of urban households. The ratios remain consistent between rural and urban communities when comparing other sanitation facilities. Additionally, only half of the schools in Papua New Guinea have access to safe water, while less than a third have access to sanitation. This is widely due to the lack of access to education in rural communities, as well as an insufficiency of resources needed to provide schools with proper WASH services.
Social determinants of health are social and economic factors that influence the people's health. In Papua New Guinea, the negligence of the government to improve the health is one of the major social determinants of health. The community faces the obstacle of receiving adequate sanitation information and facilities because of the lack of commitment by relevant national and provincial government authorities. Despite the discussions to improve health, the government's absence results in shortages of trained staff and organizational arrangements that can distribute necessary sanitation supplies and information. Moreover, the government places policies to increase clean water distribution, yet does not enforce them, as over 60% of the population uses unimproved water supplies. Both of these factors result in a lack of proper sanitation knowledge and supplies for the population. Regardless of the fact that Papua New Guinea is home to a mere 7 million people, its population belongs to 7,000 different culture groups. Yet, the government fails to acknowledge that, which leads to a lack of cultural competency in health services. Therefore, sanitation promotions are usually seen to be irrelevant as there are a plethora of cultural communication barriers. Because of this, the outcome is low health literacy.
The Papua New Guinea population faces challenges that affect behavior and health, such as menstruation in adolescent girls and defecation in rural areas that are caused by a lack of health services in relation to sanitation. Many schools report that absenteeism is prominent among adolescent girls, where they will miss school for a few days at a time. This is due to the lack of health services, including unclean and private changing rooms without access to soap, water, and sanitary pads. Unfortunately, this affects girls' learning as they are missing out on attending classes. Also, it is important to add that when the girls return to class, they have reduced self-esteem and dignity. Another important challenge is the effects of defecation in rural areas on health. Due to the lack of running water and health services available for people to relieve themselves, there is a problem with defecation in communities. The diseases that are affecting the population are waterborne diseases such as diarrhea and acute respiratory infections, which are among the principal causes of death for children under 5 years old. Over 60% of the population uses unimproved water supplies.
Gender inequality is a major concern in Papua New Guinea. Most women are bound to rural areas where traditional practices have impeded the growth of women. This has resulted in women not receiving the education they require about health. However, the government established a policy to improve women involvement and aid gender equality. Also, reports portray an ultimate climate that is a reason for water shortage in PNG. Since most schools depend on rainwater for drinking water and hand hygiene, schools should be closed when there is a shortage of water. Pregnant women and young girls are also sent long distances with jerry cans to bring water. This has led to many health concerns and rape.
Thank you. That is the end of our health promotion video. We hope that you enjoyed the presentation.